Good morning, everyone. My name is Jessica Lopez, Communications Coordinator here at United Ag. Welcome to today's Health Chat session. As always, we have Dr. Rosemary Ku again with us today, and she will share her insights on aging and brain health.
Thanks so much, Jessica. First off, I'd like to thank our sponsors, Cyan, Blue Shield of California, and Elite Medical. And thank you everyone today for joining us for a really important topic on aging and brain health. We're going to cover a lot of ground today, including healthy brain imaging, types of dementia, stroke awareness and prevention, a lot of lifestyle recommendations for how to optimize brain health, tips for caregivers, and also United Ag resources. And at the end, we'll leave time for Q&A, but feel free to also chat in the questions along the way, and I'll get to them at the end. So first off, our brains just naturally change with age, and this is pretty much expected. So while wisdom and vocabulary improve as we get older, processing might become slower, multitasking might become a bit more difficult, and we might experience some minor forgetfulness. So there is this natural decline. That's why it's so important to build up a cognitive reserve to compensate for these changes over time. However, neuroplasticity continues at all ages, and neuroplasticity is just a fancy term for the brain's ability to change and form new connections. It's basically how our brain changes according to learning. And so at all ages, we can continue to learn, and this learning continues to strengthen the brain. So it's never too late to implement changes in your lifestyle or address brain health. Also, memory changes aren't necessarily dementia. Some could actually be normal. So, for example, occasionally forgetting where you put your keys, or say if you forget an appointment and then remember later, those kind of minor memory changes that do not impact your quality of life and don't impact your daily activities can be within the realm of normal. However, more severe cognitive or memory changes, like getting lost in familiar places or repeatedly asking the same question and not being able to follow the conversation, or difficulty with tasks that you can do very easily, like paying bills, those are more severe changes that could indicate that something is going on. In addition, some memory changes or mental status changes might not be something as like long-term as dementia. They could actually be from acute health conditions. For instance, as people get older, sometimes memory lapses or mental status changes could actually be from urinary tract infections or other infections, maybe even mental health issues like anxiety or depression, or other things like abnormal blood sugar can really impact your brain activity, but those are actually short term and can be easily correctable, so they are not long term dementia. With that said, recent research, which is quite staggering, shows that 4 out of 10 Americans over age 55 will eventually develop dementia. And this is because of the growing aging population, especially with the improvement of chronic care management, people are surviving longer and end up developing dementia as they age. However, the good news is that 45%, so almost half of dementia cases, can either be prevented or delayed with lifestyle changes. So that's enormous when you think about it. But you don't have to worry about doing like a whole different lifestyle just for your brain health. Cardiovascular health, the things that you're probably already aware of doing, like exercise, eating well, that kind of stuff. Anything that you're already doing for cardiovascular health will also help your brain health. So it's good to think about these things kind of together. So it makes it a little bit less daunting. So you don't have to feel like you're doing a whole separate thing for your brain health. A lot of the things that you're doing for general health will also help optimize your brain function over time. And then lastly, I do want to point out that stroke is a leading cause of long-term disability and cognitive decline in older adults. So that's why we're going to be spending some time on that during this presentation today, because reducing your stroke risk will overall actually reduce your risk of dementia and cognitive decline over time as well. So I know this is a really busy slide. We're not going to go over it in all the details. But the reason I bring up the common types of dementia is because when people think about brain aging, dementia is usually one of the primary concerns, especially if there's a family history. So before we even talk about prevention and optimization of brain health, it's important to understand a bit about dementia. So the first thing I want to point out here is that dementia is not just one condition. There's actually a lot of different types of dementia, and I've listed out the most common ones here. And the two most common ones are Alzheimer's disease and vascular dementia. Alzheimer's is the vast majority of all dementia cases. But there are different types of dementia that are related to different types of brain dysfunction. Also, the different types of dementia start at different ages typically. Most cases are starting in older age, so 65 years or older, but there are cases of early onset. So there is a type of early onset Alzheimer's, and for Lewy body dementia and frontotemporal dementia, a little bit lower on the list here, those tend to start a little bit earlier as well. The ones that start earlier tend to be less preventable, and a lot of those earlier onset cases of dementia tend to have a family history. That's not always the case, but there's often a stronger genetic component for early types of dementia. Now, even if there is a family history of dementia, that does not mean that developing it is inevitable, and lifestyle changes are still highly valuable. And so let's dive into some of the highlighted portions here to help us understand some of the causes of dementia so we know why we're doing these preventive measures. The first is with Alzheimer's disease. So Alzheimer's disease is basically the problem in the brain is because these plaques develop, and these plaques are a buildup of amyloid beta proteins and tau proteins. They form this thing called neurofibrillary tangles. Basically, they're kind of like it's kind of like muck in the brain that ultimately causes brain cell death. And the reason I want to highlight the scientific language here of the amyloid beta and tau proteins is because these are proteins that are actually cleared during sleep. And so chronic sleep deprivation actually increases your risk of a buildup of these proteins. So the lifestyle changes that I'm going to be talking about later on in this presentation are just not, to make you feel better. They're actually related to the very science that is based on what causes dementia. Also, for vascular dementia, people don't often realize this, but strokes can cause dementia, and that type of dementia is called vascular dementia. Most people that think that strokes really just affects your mobility, but it's not true. Small strokes, even strokes that you might not know you're having, can cause damage to your blood vessels in the brain and cause vascular dementia. And you can have multiple types of dementia. So oftentimes vascular dementia is mixed with Alzheimer's disease. And so in order to prevent vascular dementia, you want to do everything you can to prevent strokes, which is often control of the vascular risk factors, not smoking, controlling chronic conditions, etc. So moving on, just want to throw in here really quickly is that the diagnosis of dementia is usually a process. You go through a medical history, very extensive physical and neuropsychological exams, mental health screenings to make sure you don't have one of those kind of causes of memory lapse that is actually correctable, like anxiety or depression. You'll go through blood tests, brain imaging, and often a neurological evaluation by a specialist can be quite helpful. And it's important that if you notice some of these changes that are affecting your daily life, to seek help or have that loved one who's having these symptoms seek help, because there are medications that can treat dementia and help preserve that memory and cognitive function, but they do work best in the earlier middle stages. And there are also lots of options to treat symptoms and the comorbidities that can happen, such as lower appetite, or dizziness, nausea, vomiting, that kind of stuff that might go along with dementia. And also, even if somebody does have a diagnosis of mild or moderate dementia, the lifestyle changes or including occupational physical therapy can be highly beneficial still. So there's truly there's no point in which not implementing lifestyle changes would make sense. So at any point in time, at any age, improving lifestyle can help brain function. So, on to stroke awareness. Stroke is caused by disrupted blood flow in the brain. So, kind of similar to a heart attack. The heart attack, what a heart attack is to the heart, is what a stroke is to the brain. So, it's kind of like a brain attack. And that blockage can either, or that disrupted blood flow can either be due to a blockage, like a disrupted plaque that can cause a clot to form, or it can be as a result of bleeding. And the strokes that are caused by a blockage are much more common. About 85% are actually this type of stroke. It's called ischemic stroke where there's a blockage. The rest are bleeding strokes, which are more common in people with very high blood pressures or with people with aneurysms where they might be at higher risk of bleeding in the brain. Now, strokes are incredibly common. It's said that every 40 seconds, someone in the US has a stroke. So that's incredibly frequent. And the thing is, strokes are highly treatable. But the key factor is getting the right treatment as soon as possible. And getting that early treatment can really make the difference between life and death and whether or not you can heal from the stroke. Every minute counts. And the earlier you can get seen, the more treatment options you typically have. And so, for instance, one of the major treatment options is really trying to break down any available clots. If it is an ischemic stroke, and if that treatment is delivered within 90 minutes, there's a 3 times likelihood, more higher likelihood of recovery fully than if that wasn't delivered within that time. So to maximize your treatment options, to maximize chances of recovery, getting treatment faster is better, and every minute really counts. So it's really important to be able to spot the symptoms of stroke. And some of you might have seen this already, but it's a basic acronym to help remember the major stroke symptoms. It's called FAST. So you can think about like if you see signs of stroke, you need to act fast. And the letters of FAST stand for face drooping. In this case, it's also face drooping or numbness. And oftentimes you can see this if you ask someone to smile and one side of their mouth is lifted up as normal and the other side is still kind of, not moving and kind of flattened down. The A stands for arm weakness. Again, this can also be numbness. Speech difficulty is also a very common symptom. That's what the S stands for. Basically, slurring speech, not being able to communicate. Sometimes people have difficulty comprehending also as well what you're saying. So any kind of speech difficulty could be a sign of stroke. And then the T is to remind you that you really need to act right away, to call 911. This isn't a situation where you want to like wait and see if the symptoms improve. Even if it does seem like the symptoms are resolving, it's really important to call 911 and get to the hospital right away to have brain imaging to make sure they can understand what's happening. However, not everyone has those common stroke symptoms. So here are some other symptoms to watch out for. They include blurry vision or double vision. I've actually seen this as a stroke where the only symptom a person really was bothered by was actually double vision. So vision changes are really important. Difficulty swallowing, depending on where that stroke is in the brain, it can really disrupt your swallowing function. So that's a really important sign. A sudden severe headache could be an early sign of a hemorrhagic stroke or a bleed in the brain. It could be a sign of a bursting aneurysm. So that's a really important thing to watch out for. Usually patients will say this is the worst headache they've ever had in their life. They can't function. That's how severe it is. And it's very sudden. Um, Also, if the stroke is kind of in the brain region that helps you move, there can actually be loss of balance and discoordination. That's often seen as like stumbling or difficulty walking. Strokes can also cause vertigo, which is the sensation of the room spinning, nausea, vomiting. And also sometimes the numbness might not necessarily feel just like numbness, like if it's in the arm or a leg or part of the face, it can actually feel like pins and needles. And then sometimes, especially in older folks who can't necessarily report their symptoms, it might just be worsening confusion or new onset confusion could actually be a sign of a stroke. So definitely watch out for these other symptoms. And it's important to remember that anyone at any age can have a stroke. I've seen strokes happen in young, healthy women, and anywhere from that to like older, older men. So there's really the whole spectrum. Anyone at any age can have a stroke. So just because someone doesn't seem like they should be in that demographic to have a stroke doesn't mean that they can't and should always get immediate care. Remember, every minute counts here. Now, how do you prevent a stroke? This is one of the most preventable conditions. The major factors are family history, chronic conditions that increase cardiovascular or clot risk, an unhealthy lifestyle, and prior stroke. So, the only way to know if you have chronic conditions that could increase your risk of stroke is if you stay up to date on health screenings. So make sure you get your annual health screening, make sure you're doing your physical exam there, get all your lab work done to make sure you have, make sure you know about your diabetes status, whether you have it or not, whether or not your blood pressure is normal or not, cholesterol, and you'll also want to screen for obstructive sleep apnea. So with sleep apnea, you basically stop breathing multiple times a night, and that decreases oxygenation to the brain, causes a lot of inflammation, and it increases risk of stroke, but also dementia. So I know health screenings can be scary, like maybe you don't want to know if you have these conditions, but I guarantee you knowing them and making sure they're well controlled can make a huge difference in preserving your brain health. In fact, one of the earliest patients I ever saw in residency was a 40-year-old man. And he ended up dying in the ICU from a stroke, really like within like a few hours of getting to hospital. And he had no medical history except for hypertension that he did not treat. And most likely, a lot of people who have high blood pressure, they don't end up getting it treated because they don't feel anything. That's why it's called the silent killer. And so these chronic conditions, it's so important to get them under control if you do have them, so that you don't have a condition that's worse, such as heart attack or stroke. It's really important to avoid tobacco, excessive alcohol, and illicit drug use. These all cause inflammation of the brain. They can also worsen your blood pressure, and they can increase your risk of stroke. Maintaining a healthy weight is important for general health as well as stroke prevention. And lastly, I do want to touch upon aspirin use because a while ago, it was almost like everyone was getting aspirin. Everyone was taking daily aspirin. But the tides have kind of changed in medicine where now we use daily aspirin a bit more sparingly because it does carry a bleeding risk, even the small dose baby aspirin. So for people who are 60 years or older, it may not be recommended to take daily aspirin, even if you have some risk factors. So it's really important to talk to your doctor before taking daily aspirin, especially if you're trying to take it to prevent heart attack or stroke. For those that are younger, like 40 to 59, if you have a lot of cardiovascular and stroke risk factors, it might make sense to take aspirin, especially if your bleeding risk is low. But again, do not just go ahead and take this on your own. Make sure you talk to your doctor so that they can help you evaluate the risk benefit ratio for taking it. Okay, so in addition to everything in the previous slide that we talked about for stroke prevention, here are some additional lifestyle changes that are really important to preserve brain health. So the first is sleep. I already mentioned this with the Alzheimer's, with the tau protein and amyloid protein, but I know sleep feels like you're not doing anything. It sometimes feels like a waste of time, but it's actually a lot is going on in your body and in your brain during that time. It's a critical time for your memories to kind of consolidate for memory formation. It's also a time when your brain actually clears a lot of metabolic waste. and prevents buildup of the proteins, the tau and amyloid that's associated with dementia. Also, as I mentioned, get your sleep apnea screening. If you do have it, you should get treated because it's been well studied that sleep deprivation, either from sleep apnea or just chronic sleep deprivation, that people are choosing not to sleep as much, or if they have other conditions like mental health conditions that impact sleep. There've been All the research has shown that poor sleep increases risk of dementia. Also, stress management is critically important. Chronic and excessive stress literally kills your brain cells. So, they've done studies that show that the hippocampus actually shrinks as a result of chronic stress, and the hippocampus is the part of your brain that's really important for memory formation. Stress actually increases your cell aging, so they age faster than they would normally, and it causes inflammation, which can cause brain cell death as well. You'll want to keep your brain engaged. So the whole like saying of use it or lose it is highly relevant to brain health. So it's important to continue to stimulate and challenge your brain at any age. And this essentially builds that cognitive reserve. So you're more able to compensate for those natural brain changes that cause a very natural decline in cognitive function. And, some people feel like, oh, they have to do like specialized apps or specialized exercises for cognitive engagement. You can do those for sure, but the most important thing is to build this cognitive engagement into everyday life. So things like learning new hobbies or skills, practicing a different language, playing a musical instrument, puzzles, games, even reading or audiobooks can actually keep your brain engaged. And those are really important kind of basic lifestyle things to do to keep your brain healthy, but they're often also really great for stress reduction. Social connections are really important to maintain as we get older. Again, this is really good for stress reduction, but engaging with others is actually another form of exercising the brain. You have to be able to follow the conversation, you have to remember what the other person says, engages empathy and critical thinking. And so it's another form of brain exercise. Here's one that most people don't think about is correcting hearing loss. So as we age, our hearing also tends to get worse. And sometimes we feel embarrassed about, going to see an audiologist and potentially getting a hearing aid. But if that hearing loss gets worse, it impacts social connections. People often tend to isolate themselves if they can't hear what other people are saying. They don't want to be a part of that conversation. Also, if the hearing loss gets severe, you're actually not getting that stimulus into the brain. And so it actually limits the cognitive engagement as well. So hearing loss and correcting that is a very easy way to make sure your brain stays healthy for as long as possible. I know a lot of people are interested in nutrition and supplements. On the nutrition side of things, there's something called the MIND diet, which is a combination of the Mediterranean diet and the DASH diet. And the DASH diet is kind of the diet for cardiovascular health, lower blood pressure. This MIND diet has been shown to lead to a 50% reduction in Alzheimer's risk. And the major components of this diet are leafy greens, berries, nuts, healthy fats from olive oil, and protein sources from essentially either vegetarian sources or fish and poultry. It's very low in processed foods, refined carbs, and also limited in red meat, especially with grain-fed red meat. And the whole point here is to stabilize your blood glucose and weight. So that's really good. The MIND diet is a combination of the Mediterranean DASH diet. Just remember that. As far as supplements go, there's no single supplement with very strong evidence for maintaining brain health. There's a lot of interest here and there's a lot of ongoing studies, but nothing is coming out as the silver bullet here. However, if you do have nutritional deficiencies or vitamin deficiencies, such as B vitamins or vitamin D deficiency, it's very important to correct those deficiencies with supplements because these are vitamins that are linked to brain function. So ask your doctor, you can get tested for that and make sure your levels are optimized. And then lastly, um, we always talk about exercise, how that's really healthy. It's actually been shown that people who exercise regularly have a 30 to 40% lower dementia risk. And that's because exercise improves blood flow to the brain, it reduces inflammation, and it affects those cardiovascular risk factors. So, again, cardiovascular risk is also good for your cardiovascular risk equals brain health. So, you want to make sure that you are getting that regular exercise. And then lastly, I know a lot of you in this age group might be taking care of someone, either older relative or parents, who might be declining or aging, either with dementia or just kind of natural aging. And here are just some quick tips. The first is to create a safe home environment. So make sure there's very low fall risk. Invest in appliances with auto shutoffs, that kind of thing, to make sure that it's a safe environment for someone who might be starting to slow down a bit cognitively. Again, make sure there's lots of opportunities for mental stimulation and socialization. So encourage your loved ones to, still meet up with friends, talk to friends on the phone, etc. And also to help them stay independent. I know it's really tempting to kind of do a lot of things for people that you care about, but encourage them to be as independent as possible and only help out if it's really necessary. Um, a lot of folks who get older don't want to go to the doctor. Some like to go because they like to, have that social connection, but a lot of others don't want to go to the doctor. But make sure they're still getting their regular checkups, especially, for control of those chronic condition risk factors that we talked about. Medication and pill organizers are really helpful here to make sure that they are taking their meds regularly. Also, as people do age, there can be changes in emotional health, personality, mental health changes can actually develop as someone gets older. So, someone could have no history of mental health issues when they're younger, but then, as they get older, they might start developing anxiety or depression, and that can change. So, recognize those changes and, seek out health care if you notice that happening. There's typically a lot of community resources for seniors, either events or specific exercise classes, educational classes, medical transportation, also meal services can help. And make sure you're also getting the rest of the family members engaged to help you. Or if you don't have family around that can help you take care of your loved one, do look into professional caregiver services, because the most important thing here is that you can't really pour from an empty cup. So, as a caregiver, it's very easy to get overwhelmed. It's a very hard task, it's very stressful. And so, you have to take care of yourself before you can really take care of others. And then lastly, at UnitedAg, we're really here to support you. Our health and wellness clinics are wonderful for regular health screenings. They'll also help you manage any chronic diseases that you have, including helping you manage your medications, streamlining them, and then following up with you to make sure you're meeting your goals. The lifestyle coaching program is wonderful. They are very high touch. It's one-on-one, completely free. And also, there's really no excuse not to get care there because we have in-person and virtual care options. You can also go to Teladoc if you want to. They're a great option and very convenient one. And then, as I mentioned, mental health can become an issue for those who are aging. It's also really important to, check in with your mental health if you are taking care of someone who's older. So Spring Health is available to you for that kind of support. And with that, we will open up to questions. I know we covered a lot of ground today.
Rosemary, Richard is asking, first of all, thank you, Rosemary, he says.
Oh, okay, thank
Uh,
you.
any tips on caregiver burnout?
Yeah, that's a great question. And it's a very real phenomenon that is very common. So the most important thing is to try to get additional resources to help with caregiver burnout. One, to recognize that it's happening. So if you notice yourself kind of, feeling less empathetic, you feel like you don't have a lot of bandwidth to take care of somebody, that could be a very early sign of burnout. So address it when it's early on if you can. And then also look for resources. So ask for help, either friends and family, or even talk to the doctor. The healthcare team can also suggest resources. There are also, in-home care resources that you might qualify for. And so you're not going to know about them until you ask. So definitely ask either a doctor or social worker on the care team to see what's available there. But very great question. Any other questions? I know we're running past time.
Oh, yeah, we have one more that came in. Is occasional numbness normal, or this should always be looked into? Usually feel if I am in one position too long.
Yeah, that's a great question. So the numbness that's associated with stroke is usually sudden and it comes along with usually other kind of the stroke symptoms that we talked about. Occasional numbness should still be evaluated, especially if it's kind of minor and only if it's positional. It sounds like really it's more related to musculoskeletal, so it could be something like a pinched nerve or something like that. However, it's really important to still get that looked into so that it doesn't worsen over time and so you have an understanding of why that's happening. If it's ever like, suddenly worse or you're really not sure, stroke is not something that anyone should have to try to diagnose themselves. Like it, you don't have to look up an exam online. You don't have to kind of, you know, be embarrassed about, what if I go to the emergency room and it's not a stroke? If there's ever any doubt that something is happening, go seek help. With occasional numbness that's positional, it's less likely to be something severe, but it's still important to get medical attention and answers for that. Great question.
What is a mini stroke, and is it true that sometimes a migraine can have mini stroke symptoms?
Yeah, great question. A mini stroke is often referred to what the medical professionals call TIA or transient ischemic attack. So it's basically there is a small stroke that kind of resolves on itself. So there could be stroke symptoms that only last for like a few hours and then just resolve. And there might not be any lasting symptoms. And it also might not show up on something like a CAT scan. And so, however, if someone does have a mini stroke or a TIA, it can increase their risk of having a larger stroke in the future. So even if somebody has a mini stroke, they're usually still monitored in the hospital for a length of time to make sure they don't get worse and to do a workup to make sure it's not something else or to kind of have a formal diagnosis of the transient ischemic attack. And yes, it is true that migraine symptoms can sometimes have mini stroke symptoms. A lot of migraines can impact vision. It can cause the nausea, vomiting, and it can cause certainly, a very severe headache. Um, so if you do have a history of migraine, most likely you would have probably had, a medical workup with that. But if not, it's important to still talk to your doctor, say, hey, I think I've been having migraines for a while. I just want to make sure, and they can do a full physical exam and potentially any brain imaging if they feel like it's necessary to rule out anything more serious. Great question. Anything else? All right. Jessica, are there any kind of announcements you would like to provide before we close up?
Yeah. Um, just to save the date for our last episode of the year that is set on December 4th, and it's going to be on endocrine disruptors and hormonal health. And then also to be sure to follow us on our social media channels. We're on Instagram, Facebook, LinkedIn, and Twitter. So that way you can stay updated with all of our events. Thank you so much.
Great. Thanks, everyone.